Almost 1 in 3 adults in Taiwan has high blood pressure, according to the Health Promotion Administration. A new set of official guidelines has been published to help the public avoid the condition.
Officials say adults should measure their blood pressure annually to keep track of their health. But going to a doctor isn't the best way. Instead, take several readings at home over the course of a week. Then take an average of those measurements. That way, you get a more accurate sense of your overall health, say doctors.
Lunar New Year, lots of gatherings with loved ones, lots of rich food, and perhaps without noticing it, lots of calories, fat, and sugar. Throw in a bit of sleep deprivation and it's a recipe for high blood pressure. Statistics are out for the HPA's Taiwan Nutrition and Health Survey from 2017 to 2020. They show that 26.8% of adults over the age of 18 have high blood pressure.
Food that high in fat, in salt, in sugar, low in fiber, these things are fatal for blood pressure.
The HPA recently published its 2022 guidelines for managing high blood pressure. It urges caution if your readings go over 120/80, and it advises measuring your blood pressure at home instead of going to a clinic. If you see a doctor, the stress can increase your blood pressure and skew the results.
What that means in a general sense is that blood pressure is usually higher at a medical center, but it goes down when you go home, so it just gets higher when you go to a medical center. We've launched the motto 722. It means, for 7 days straight, measure your blood tension twice back to back, and do that on 2 separate occasions each day. Then take an average of all the readings to understand whether you have a tendency towards high blood pressure.
The HPA says everyone over 18 should measure their blood pressure at least once a year. If you use the 722 method, you'll be more likely to get an accurate picture of your health.